professionals, we can deliver those at the consumer level, which will change the relationship with primary care and the relationship that consumers have with the healthcare system. Which sort of leads into the third point there, where I think I'd like to spend the most time over the next 3 to 5 years, and that's really around AI-driven coaches. We can't afford as a healthcare system to have every person have a one-on-one coach or healthcare professional assigned to them to help them manage their health, their lives, their diseases. But as AI can give us, generative AI, particularly wellness coaches, primary care professionals, physical therapists, clinical gatekeepers that help better understand and diagnose where a consumer is and then direct them to the appropriate level of care, that's a level of resource that we've never been able to dedicate to anyone but the sickest population. Now we'll be able to provide that to everyone, and that gets us into a more preventative style of helping to promote and maintain health versus wait for someone to be sick and then patch them up afterwards.
Thanks, Scott. I mean, that has quite a lot of interesting issues you've raised. I mean, it's interesting, one, on the issue of information disposal and sort of changes to primary care. And one of the things we have been thinking about in Anadach is, how does AI sort of affect the different levels of care? And so here you're sort of mentioning something, primary care, maybe vis-a-vis sort of specialty care, which is sort of interesting. And the issue of clinical gatekeepers. Anyway, with that, Dr. Rennie, what do you think, 5 years down the road, especially from the Indian perspective? I mean, given what's happened in India on financial inclusion with sort of fintech and what, other countries achieved in 30 or 40 years, India has achieved in 5, what do you think will happen in the next sort of 5 years in the healthcare space?
Honestly, I wish one could say with certainty. If we look at the exponential increase in its capacity just in the last 2 quarters, right, when ChatGPT was really put in our hands first, and we started to have an interface to play with it, and last week's announcement of Gemini from Google, a massive leap in terms of capabilities that it's had, in terms of audio, visual, photographic, sentiment analysis, communicative humor, logical reasoning, etc. I am scared to try and think about what it will be in 5 years. I mean, it's taken how many billions of years, 1.5 billion years, to go from the tree to the human being in terms of animal and mammalian evolution, and then we're thinking about what this can do in the matter of months, weeks, and days. So I'm not sure what 5 years look like. All I do know is that you're absolutely right. India has bet big on digital India. It was one of the big missions of our Prime Minister Modi. The financial sector has been transformed by UPI, which is the payments gateway. We have now digitally marked practically 95, 96% of our entire population of 1.4 billion. They are now online with a digital identity, and using that same infrastructure stack, it is being replicated for other services, including health, the health stack, which was announced earlier in this year. So I think we're going to see a big explosion in services, startups, and other types of companies building on top of the health stack, part of our efforts towards universal health care as well. So we're very excited, but what 5 years will be, I wish I had a little ball that could tell me.
Okay. I think this is really interesting, Dr. Rani Marcus, if I may, because really it's almost scary. And I suppose also going back to the first panel, I mean, and when Dr. Twenko takes questions, because in my view, what does this mean for the training of healthcare workers of the future? Because for them, this is really part of their lives. It's not going to be sort of an additional bit to their lives. So what does this mean as you train? I know we talked about AI and the use of training healthcare workers, but what does this mean for curriculums or, or how you train people to think about, this type of issues, and also to make sure some of these issues are driven by a clinical perspective and not just a technological perspective. And so to sort of, I think in this panel, I'll just do one more round of questions. Anna, from your perspective, I mean, we've talked about, but what do you see as some of the major sort of regulatory, ethical, technical challenges that need to be addressed in the future? I mean, I mean, you're active in, I'm not sure how many countries, but you might want to actually talk about that. But you're active in several countries, and I presume with different sort of regulatory environments. So what do you see as sort of major challenges? But I'll also be interested in how it works for you, working in different countries with different organizations and different systems.
Yeah. Right now we are operating in 9 countries in MEA region, Middle East and Africa. And unfortunately, the regulations in most of over the globe, it's a way, especially when it comes to the healthcare, it's a way behind the technology overall, and this is something very normal that regulations overall cannot actually be ahead of the technology. Most of the time, technology will be ahead of the regulations. Till now, there's a lot of discussions going back and forth about the telehealth, teleconsultations, and so on. And we are talking about the AI, which is a totally different level in general. But so one of the very important things, which is which is something very happening in a very good way in Africa nowadays, which is it's more focus about the ethical AI and how we can work on the ethics behind the AI more than the regulations overall. So how we can deal the regulations? It's something there is a lot of varies between a country to another. And by the way, AI itself can help us to adapt with these regulations, by the way. So as an example, we have an AI algorithm which is help us for the matchmaking based on the regulations and the qualifications of radiologists, as an example. So if we have right now, we have more than 200 radiologists working actively on our platform, and the matchmaking of this radiologist based on regulations and certificates, experience level, and all of this stuff, we do that through an AI algorithm, as an example. But overall, I believe anyone who work on the technology space overall need to not think a lot about the regulations from the beginning until have something very solid when it comes to the output, and then before the commercialization, we can start to think about how we can adapt this with the regulations overall. And also thank you for the technology again, that it helps us to be that flexible when it comes to how to implement the technology, adapting with the regulations which is already in these countries overall.
Okay, thanks very much, Amer. Court, so what do you think? I mean, what are some of the major sort of regulatory, ethical, and technical challenges?
Yeah, excellent question. I think from the one I'd like to hit on from an ethical and societal perspective really gets down to trust and how consumers, how people in the communities that access our health systems can trust that the algorithms that we're using are accurate. Every model is biased by definition, right? It's based on the data set that's used for training. It's based on the data you include and don't include. That ends up shaping the results, and every model as a result is going to have a bias in one way or another. But the challenge we have with AI, particularly with generative AI, is the large language models are so large that it is almost impossible for us to understand the explanatory process that the AI used to get to its conclusion. With a typical algorithm, we can go back and we can take apart that algorithm and try to understand how it's biased in one way or another, and we can correct for it. But with generative AI, we see the result, but it's beyond our human capabilities to understand how the AI worked through that massive amount of data to get to the answer. And I think that's really the challenge. Consumers aren't going to trust the output if they don't understand how, if we can't explain how we got there, right? It's in the same way that a physician is not going to trust the predictive qualities of an algorithm unless we can explain the math that allowed us to calculate that risk score. And so I think that trust from a consumer perspective, from a societal perspective, is really going to be the biggest challenge that we have with adopting AI on a much more widespread level.
Okay, thank you so much. And I think after this, there's going to be a round of questions. But Marcus, as you think about this legal, the ethical, sort of regulatory, sort of technical issues going forward, one of the comments in the chat box was really not using AI as an excuse to avoid addressing healthcare workforce shortages, but also there was a critical outlook which looked at AI from a perspective of the global north sort of imposing on the global south. You know, so given all those various issues and given the fact that India in many ways has used technology, like we talked about, you know, on sort of expansion, on expanding services to the folks, especially on financial issues. What do you think are the concerns from the legal, regulatory, ethical perspectives, you know, of AI going forward in healthcare?
I think everyone is understandably anxious about the data because the data is being used, as Kurt was saying, to train models. There's a lot of issues around data privacy, and lots of geographic nations are now thinking about how to create the right sort of firewalls to protect their citizens' data locally, as opposed to it being exported elsewhere. So I think that's going to be a big challenge for all of us to overcome, because it's very easy to produce data, but then sharing data and then securing it with the breaches, etc., are a big challenge for all of us. So I think in the immediate and near term, certainly something that companies like ours are looking out for. It's this big question around data privacy, security, what to do with that information, where we store it, how we keep it, who has access to it, etc. And I think that's a big area that everyone's working towards.
Okay. No, thank you. I think this is a really interesting way to at least end this panel. One of the things that I think that you have raised, and you know, is that what if somebody else has access to that data and can tell sort of behavior and what can influence sort of millions of people? And so you can imagine it having either commercial or sort of or less philanthropic uses of such data. But at this point, I mean, I think there are a couple of questions, and if there are any questions for any of the speakers raised, I really would encourage people to sort of put it in the chat box. And at this, I'm going to hand over to Kate for the next 10 minutes or so to take questions.
Great. Well, I'm going to keep an eye on the chat to see what questions come up. But I wanted to ask a question based on something that you said. You mentioned that in artificial intelligence, it's not just about the content we teach about diseases, but what we might teach health workers about how to use HI and that sort of digital literacy. There's been a lot of discussion about that for the past decade, but I don't think digital literacy has been integrated into nursing school, medical school, you know, as much as it should have been. So I'd like to open this question up to all the panelists. You know, what do you think needs to be integrated into health worker education, whether it's, you know, in pre-service education or continuing professional education, so that health workers understand how to use artificial intelligence, how to integrate it in their clinical practice, what's their responsibility as a clinician, what's sort of the role and responsibility of the artificial intelligence? Anyone interested in handling that? It's fun.
I'm thinking.
Well, actually, a question I have for you is, I know that in addition to a full medical school and full nursing school online, Lecturio also has short courses. Have you been asked to do short courses about digital literacy, about how to use, mobile platforms?
It's a good question. So we certainly, in general, before ChatGPT already believed that it makes sense to train clinicians not only in medicine. They're part of complex systems, they're part of teams, so you need to train them in business, in negotiation and communication, and these kinds of things for these systems to function.